the Simpler Education Series webcast. Today's webcast is titled Starting Up Your Enrollment Operation with speaker Donna Goestenkors and Dina Solis. At the end of this session, we'll have time for a formal Q&A, but feel free to ask any questions as they come to mind via the chat box located on the right side of your screen. Donna?
Okay, wonderful. Hello, everyone, and a warm welcome to all of our listeners. Today's program is Session 2 of the Mastering Enrollment webinar series. It looks like we have lots of returning guests and many more new attendees, and that is just so cool. I have great news to share with our audience. Number one, we have just about hit the maximum registration count for this session. Number two, by the number of messages Dina and I have processed since last month's program, it's clear that we have sparked the flame of attention within the industry and among our colleagues, and the energy and validation about this area of specialty is palpable, even felt electronically. And number three, I saved the best news for last. I attended a meeting last week where NAM's leaders, Linda Waldorf, the president, and Bonnie Gutierrez, the president-elect, were present and reported that NAMS has identified a strategic initiative to expand the membership and specifically recognized the value of enrollment specialists. So stay tuned about more news to come from NAMS. Who knows? Maybe an enrollment certification is closer than we thought, even just a month ago. So see, working together, we really can make a difference. I hope many of you believe, like me, that we are in this field learning together. No man or woman is an island. No one is a master in all things, and there truly is power in numbers. I know that my personal success formula has been to surround myself with quality products and professionals. The presentation of this program is no different. Every one of the organizations identified on this slide, slide number 2, is an example of synergy and collaboration. symplr is our wonderful vendor host. And I'd like to ask Amy or Callie, did you have any message that you would like to share with our audience?
Sure. The Simpler Education Series is sponsored by symplr Compliance and Credentialing for Healthcare, formerly known as MedKinetics and Payer Enrollment Services. The broadcast today is also sponsored by Team Med Global Healthcare Consulting, MSP, and the Texas Society for Medical Services Specialists.
Excuse me, Amy.
Go ahead.
I was going to say, before you continue, Amy, I wanted to underscore that TISMIS, the very state organization that's part of NAMS, they were instrumental in being sure that this program and this entire series is awarded NAMS CEU hours. So we really appreciate their support in this initiative.
We're so pleased to have Donna Goestenkors as our main speaker this month. Donna is a full-time healthcare consultant, speaker, author, educator, and mentor serving the medical staff services industry for more than 39 years. I'm sure many of you know her, and I'd like to turn it over officially to you now, Donna.
Wonderful. Here I am, everyone. Everyone, look on your screen. I see you out there, but that's me, Donna Goestenkors. I'd like to introduce my co-presenter and field expert, Dina Solis. Dina?
Hello. Hello, everybody. Thank you, Donna, and thank you for asking me to help co-present with you. It's been a real honor.
Yes, I'm excited. And so Dina, what are you and I going to be able to share with the group today? Well, really, we're actually going to walk you through the steps in completing a payer enrollment application. And then we're going to close out the session with things to be aware of that will advance your practice and elevate your competence. And just a final reminder, please know that throughout the program you can post your question in the dialog box on your screen. And at the end of the program, Dina and I will answer as many of them as time will allow. Immediately post-program, and this is really important because we get frequent questions, not only during the Q&A, but also after the program. Just be aware that you will be receiving a copy of the PowerPoint, the NAMC EU certificate, and an attendance certificate. And as a special bonus, Dina and I are going to be making available to all of our listeners a sample enrollment application and a checklist, both that can be added to your resource library. So let's get ready to learn. You know, no one can make positive discoveries like learning about enrollment that can make their job or career better if they never try anything new. Your attendance today is trying something new, so thanks. What we learned in session 1 is about enrollment, that it can be referred to in many different ways, but the definition of what enrollment is very simply the process of applying to health insurance plans and networks for inclusion into provider panels so they can bill and get paid for the services that are rendered. What else did we learn? Last month, it was about the types of enrollment that you might encounter. We have the federal and state programs, Medicare and Medicaid. We have private and commercial enrollments, which would be your insurance companies, Blue Cross, Blue Shield, Aetna. Dina, can you think of another, some of the larger hitter insurance companies just to create a point of reference for our listeners?
Sure. There's Cigna, Humana, HealthNet, those types of payers.
Wonderful. Thanks, Dina. And then workers' compensation. And I think, again, it's important to try to simplify this process as much as possible. So understanding that the types of enrollment that you might encounter primarily fall into these 3 buckets. As Dina and I were preparing for this particular session, we wanted to try to introduce this information in the easiest and the most simplistic way as possible. And what we've identified is really enrollment can be broken out into 2 steps: the pre-enrollment and then the post-enrollment. And there are sequential steps that fall under each of those categories. But again, if you can use this as your point of reference as you approach enrollment, as you're wanting to learn more about enrollment, that it really is a matter of taking steps. So the 2 steps for enrollment are pre-enrollment. And what do those look like? It really comes down to 4 key steps. You want to first determine which plans to enroll in, and Dina will provide that drill down and that insight as we move forward into the program. The pre-enrollment components can be broken down again into the next step, which is collecting information and documents from the practitioner or provider. And then the 3rd step in the pre-enrollment piece would be obtaining, completing, and submitting the application to the appropriate server or vendor. And then the last step in the pre-enrollment process is following up, doing the follow-up. And those of us who are MSPs and have worked in medical staff services for any length of time in particular from the credentialing standpoint, we know how critical following up with any areas of red flag or missing information is important. So that really is kind of the crosswalk to understanding that there really are parallels between enrollment and those of us who are doing credentialing. So again, the process of pre-enrollment can be broken into these 4 steps. And now I'd like to ask Dina to really provide our listeners with that drill down. What does determining which plans to enroll in mean? Dina, take it.
Thank you, Donna. So the first step that we're speaking of is determining which plans to enroll in. So you may or may not have a predetermined list of payers based on your group or hospital or your organization. You may be handed a list. If so, then that's great. But if not, you can use a resource such as the Atlantic Information Services Directory of U.S. Health Plans. In our first webinar, I gave some information on how to locate that information regarding that directory. If that's needed again, I can review that toward the end. But they have their own website, and in that directory, just so you're aware, you can search health plans by state. So it's very helpful. It has all of the information as far as what types of plans are available, their demographic information, and their service area covered. So it's very helpful. So then you could go to the payer's website after you've determined which payers to enroll, and you can find some information on what the process is there, or you can call their provider enrollment department or provider relations and just ask some specific questions. I usually will ask what their enrollment processing time frame is, and if there's any special requirements or extra forms or fees that's required. And I also always ask what their preferred submission is, if they prefer online, if it's quicker online or paper. Some payers still prefer the old paper method. So that when they're paper method, I always ask for an overnight mailing address, because most payers will have a post office box to submit documents and paperwork. And I always ask, they don't usually have it on their website, and so I always ask if there is an overnight mailing address, and that's very helpful to track for tracking purposes.
Dina, before we go to step 2, may I pause here and look at this first element under step 1, predetermined based on group and hospital. So as an enroller, it is very clear which plans a provider would need to be enrolled in, because it's based upon what contracts have been entered into by that group or hospital. Is that correct?
Right. Yes. Definitely.
What happens if the hospital is in the negotiation phases with an insurance plan? Is that something that well, maybe I'll stop there and ask that question. What happens? Have you had that experience where a hospital is currently in negotiations? They have an existing contract with that particular provider, with that insurance company, but how do you know if they're in negotiations that that's still going to be valid?
I would think that enrollment would happen after the contract is in effect.
Okay. Wonderful.
So that would, I could be wrong, but in my experience, it would be typical that the enrollment would happen only if the contract is in effect.
So from your experience, that has never really been a challenge area. It's pretty cut and dried which plans need to be enrolled, which providers need to be enrolled into which plans.
Yes, I would imagine that that would be the case, that you would have a predetermined list, and if your organization needs help with a list or finding out which plans to enroll in, then there are other resources available that you can use.
Like internal resources?
Well, the resource that I've given is one that I've used.
That AIS directory?
Yes.
Okay, which is item number 2 on listed under the step 1s. Okay, thank you, Dina. I just needed to clarify that a little bit more because that is a question that I'm asked. So I was hoping that it might address someone else out in our listening audience who may have that same experience and wasn't sure if there's that gray area. But from what I'm hearing, your experience is it's really not a gray area. It's just a matter of understanding what that facility's participating plans may be, and then checking with the directory if there's questions.
Right.
All right, wonderful. Let's go on then, please, Dina, if you could share step number 2 in the content.
Okay. So the next step in your pre-enrollment process would be to collect the provider's information and documentation. And that could come to you in the form of a pre-application. It could come some information you may need to get from CAQH, depending on the payer. And you can gather information from the provider's NPI registry, or your organization might also have a repository for information and documentation. And by that, it could mean that there's a shared document sharing service that you could be utilizing. It just depends on your organization. And then the next step in that would be to review your application and all your information and QA it for completeness and accuracy. Sometimes providers, or you may get an application that may be sent your way that might be missing a suite number that you may see on some of the supporting documents, and it might not be on the application, or vice versa. There might be missing a 9-digit zip code, just making sure that it's complete and accurate. And as a follow-up to that, you would want to check addresses. Most applications require a 9-digit zip code, so you can go onto, what I find helpful is to go onto the United States Post Office website and do the zip code +4 lookup. And that will give you information on the address's county as well, because the county is usually asked for on applications. And then you'll want to make sure that you check all the names and addresses and expiration dates on any licensure or supporting documentation. You would be surprised at what you might get that could be expired or close to being expired. Sometimes addresses might be a digit off, or the name, there might be a typo in the name. So just making sure that everything matches up to each other. And then the next step for the pre-enrollment process would be to obtain, complete, and submit your application. And so to obtain the application, I'll start with that. Sometimes the applications are online, sometimes they're paper and they're available online. Some payers will actually mail you an application, believe it or not. I've had some state Medicaids where they will only mail you an application. So just a quick note about that. But in completing the application, the instructions are really a great reference for a lot of questions. I know that seems like a no-brainer, but you may get an application and it could be 30 pages long, and it looks extremely daunting. But if you take the time to actually read through some of the applications, a lot of questions could be answered just in the instructions. And then another element of the application, the first element actually, is the provider identifying information. And so this would be their practice information. This is where education, training, on internships, residencies, fellowships, all of that information would go. And the next element would be provider licensure and certifications, like board certifications, any type of life support certifications, hospital, institutional affiliations, past and present, just depending on the application. This is an application element that you can just have to be prepared to fill out. And in the next area, we have the provider's peer references and work history. And work history, applications could want to go back as far as 5 or 10 years. So that's just to be prepared for that information. And the next would be further into the practice information. So if the provider has a primary practice, a secondary and third tertiary practice location, a description of the services provided after the applications asked well. And, excuse me, professional liability insurance is also an area that is asked for. Some payers, like I said before, some payers would want to go back as far as much as 5 to 10 years. So just to be prepared to be able to answer those types of questions.
Dina,
oh,
I'm sorry, go ahead.
And then also, just as a side note with that, some payers might ask for proof of the liability insurance coverage as far back as 5 or 10 years. So just be prepared that that might be something that might be asked for.
Okay, a question that I have as I'm looking on the screen and seeing these elements, I see a lot of crosswalk points for those of us, excuse me, who do credentialing. How do you know when you're filling out an application that what you're recording on that application is accurate? And an example would be work history.
How do we know it's accurate? Well,
yes.
It can be cross-referenced with the CV as far as work history.
Mm-hmm.
It can be cross-referenced with the provider's CAQH file.
Okay. Have you, when you've completed applications, have you seen discrepancies that created, you know, a pause for you to do a little bit more research? Or
sure.
Okay.
There are times that I've had to go back and ask the provider, just clarifying information. There might be dates that might be a little bit off, or just to, you know, could be a typo. It could be hard to read on an application. So sometimes there are times that call for having to go back for clarifying information as well.
Okay, thank you.
Sure.
Are we ready for the next slide?
Yes, please.
Okay, step 3 is quite long, isn't it? We have more items for step 3.
Okay, so we have more. We're just continuing our application elements. So some of the information that's asked for on the application include billing information. So this could include basically payers want to know how you'll be submitting your claims. If you're using a clearinghouse, this could be where a third-party administrator information goes, pay-to addresses, contact information, that kind of stuff. And then there's always an area for attestation questions and legal disclosures. So it's very important to have that area completed as well, and not just left blank or leaving it blank. And if it doesn't apply, make sure you always write NA in those areas, because those are areas that are paid particular attention to by payers. There's always ownership and controlled interest disclosures in an application. So that's a very important area to make sure that it's accurate and complete. And there's always, there's usually some information release to payers and acknowledgments. And there's typically a provider agreement. This could be in the form of a separate agreement, or it could be actually included in the application itself. And then there's also, along with that, usually an EFT agreement for being paid electronically. And there's typically a checklist of attachments to include with your application.
In what you're describing here so far in steps 1 through 3, Dina, these are general components of an application. Some of these may not be consistently asked for in each application. There might be nuances, some additional things, but these are some of the core items.
That's right.
Okay. I'm sorry?
Absolutely. Every payer's application and what they ask for are different, but these are just the general elements that are typically asked for.
So it's creating, in a sense, a baseline for us to have a better understanding about what components would be on an application in a general sense.
Absolutely.
All right. All right, then, let's move on to some of the attachments.
This is just a list of typical application attachments that are usually asked for by payers. So what they're looking for are all applicable professional, medical, federal, state, local licensure, any certifications or registrations that the provider may have. Typically, payers would like to see copies of those. So it's important to have those on hand. And just kind of a little side note to the application attachments. It's just as a tip and a best practice, I like to save electronically, save each separate license or certification or registration. Anything that's on this list, you'll want to save electronically individually, not as a group of attachments, because it comes in very helpful for online applications that require uploading documents. Online applications that require uploading documents typically ask for one document at a time. So it's very helpful if you have those saved electronically or wherever your repository is for your, if they're in your credentialing software or if they're on your server or in the cloud, just make sure you save them separately so they can be pulled individually for any types of online applications.
Yeah, that's a good tip, actually. I could see where that would be a challenge if you tried to save it all as one attachment. Yeah, so it would save work really in the long run. Having to save these documents individually may require some upfront work, but when you're having to transfer it to the applications as separates, the work's already done. It's just a matter of copying.
Right, exactly. I mean, in my particular situation, I'm usually handed a file of documents electronically, and they're typically all one file or maybe a couple files because of how large the file size is. So I typically have to go through and, save each document separately. I usually name it with the expiration date too. I usually put the provider's name, what license it is, kind of an abbreviated version, and then the expiration date. So if I'm working with a provider over a long period of time, then I have sort of a library of their documents, and I can tell which ones are the most current.
Dina, do you know approximately how long that pre-work takes you? Just as a rough idea, when you get information and you begin to identify and label them individually on a provider or practitioner, what would be your time frame?
Well, it depends on what you're working with. If you're working with a software that you're having to data enter all the information and upload documents, that can take quite a bit more time than somebody who's working independently in a smaller operation. So I would say, gosh, it could take a good couple hours to enter the provider's information and save individually each document, rename them.
Okay.
easily like a couple hours, I would say.
Sure, and the reason I asked that question, because again, there are many listeners who come from the credentialing world, and from a point of reference, when we are doing processing applications for practitioners, it takes that amount of time, or a relatively that amount of time, to validate and enter the information into the software if we're lucky enough to have it. So I do understand what you're saying. So it's not, it wouldn't be a foreign animal is really my point. There is really a crosswalk to that.
Absolutely, absolutely. Okay, so the next item, I just would like to make a note on the second bullet point, the IRS issued CP 575. That would be your proof of tax ID number for an organization and shows the legal name of the applicant. And just as a side note, on your applications, that name that's listed on the CP 575 is typically required to match the legal name of the applicant on the application. So that's usually indicated on the application that those two names must match exactly. And I've had delays, and I've seen where an enrollment can be delayed because those two names are not matching exactly in the field on the application versus what's stated on the CP 575. And then they are typically required to match exactly on the IRS W-9 as well. So the third bullet point would be typical tip, and this is just if it's applicable, if your provider is incorporated or has a partnership agreement in place, a copy of that is typically asked for on an application. And now this is just, remember, this is just if it's applicable. Okay, so obviously copies of any professional degree, fellowship, residency. Sometimes the payer might ask for CEUs, a driver's DL. DL means driver's license, and sometimes I've had pictures asked for as well, like a little 2x2 picture or something like that. So not totally typical, but definitely a driver's license with some payers like Medi-Cal comes to mind. Again, professional, general, and workers' comp insurance, just showing proof of that. Payers typically ask for that. And some payers, as a side note, some payers will want to be listed as an additional insured on your general or professional liability. So just be sort of aware that, and I'm thinking of Medi-Cal and comes to mind, Medi-Cal likes to be named as an additional insured, so you may have to they may come back and say your liability face sheet needs to say, reflect this name and address. So just be aware that that could be asked for. Copy of a voided check. This would be for any applicable EFT agreements. So again, that would be for electronics funds transfer. If you're wanting to sign your provider up to receive payments electronically, typically a copy of a voided check or a letter from the bank saying, just reflecting their account number and name and their routing number is usually what's asked for. Again, for California Medi-Cal, typically a copy of a lease agreement for the practice location is asked for. And then any applicable application fees would be an attachment as well.
Give us a ballpark figure about what you're seeing with regards to application fees.
Well, that is really, it's a CMS regulated fee. Typically, I think the fee right now for coverage year 2015 is $542. I can't off the top of my head. It's around $550. And that is really based on the provider. I believe practitioners are exempt from that, but it's, again, we're speaking to a wide audience, and that would just be if it's applicable to your provider type.
Got it.
And then you always want to include, for any paper applications or any types of supporting documents that you're submitting via mail, you would want to include a cover letter that includes the provider's name, their tax ID number, their address. You want to state the purpose of your submission, if it's as supporting documentation, if it's an initial application. Sometimes you'll need to submit a cover letter for additional information that a payer may ask for, and they might give you a document control number or an application number. So it's really important to make sure that if you're submitting any type of correspondence that's in follow-up to an application that you've already submitted, make sure that you're including any type of document ID number on your documents. Sometimes payers will ask that you put the document ID number on every single piece of paper that you're sending to them, and sometimes not. It just depends on the payer. But just to be aware of that type of information that may need to be submitted. And I think that pretty much wraps up my application attachments.
It does. So you want to address step 4?
So in the pre-enrollment, the step 4 in the pre-enrollment process is to follow up until a determination is made. So this is all about communication. So the payer there's 2 parts of this. Following up on the payer side and following up on your side. So on your side, meaning when I submit an application, I always give it about a week or 2 to make sure that it's at least received. Some payers have an online tracking system. Sometimes you can follow up with them via email or phone. Sometimes, believe it or not, payers might only respond or accept communications via fax. And then also the next bullet, responding promptly to any requests from the payer for more information. So that's the follow-up also. Sometimes payers will ask for additional information, so it's very important to respond promptly to anything that a payer asks for. And then also you'll want to give updates to your provider or your supervisor, or log them in your system, whichever is applicable to your organization. And then if you're approved with a payer, it's not always automatic that you'll be notified with something that proves your acceptance. You may need to ask for some type of letter, sometimes payers will say, we sent you a welcome letter and maybe the provider didn't get it, or maybe they'll fax it and the provider didn't get it. So there's usually some follow-up that's required, that requires you to ask for some type of proof of acceptance. And then if the provider is denied, I usually ask why, because there could be, this could be stated in their communication to you and it might not. So if it's not stated, I would ask why, because it could be that their panel's closed for that particular provider type, and it could be that it's closed for a certain period of time. So you want to ask why, ask those types of questions, because you may want to reapply in a certain period of time. Mm-hmm. And then also asking why. It could be that something was wrong with the application. Typically in that case, the provider would be notified, but sometimes not. So always ask, and then if you need to reapply, and then make sure you put it in your queue to, if it's 3 months, 6 months, that the payer might be saying that their panel might open up. Just make sure that you follow up and keep on top of that for your provider.
All right, Dina. You've just walked us through the first 4 steps of the pre-enrollment process. And again, I want to pause. just for a brief review, because this is a lot of information, and I think it's so appropriate for regardless of the work that we do. You have these overarching themes of the project, and we know that there's lots of moving parts underneath that project name. So because the audience is looking at the slides that are before them, they don't have the slides in front of them as of yet, I thought it was important that we just take a moment here and just reinforce that from our presentation of the material, there are 2 steps to the enrollment process. The pre-enrollment, and that pre-enrollment is broken out into these 4 steps. 1, determining which plans to enroll in. Number 2, collecting the provider information and documents. Number 3, obtaining, completing, and submitting the application. And then 4, which you've just very clearly described, making sure we do the necessary follow-ups. So with that closing out our pre-enrollment, I'd like to ask you also to help us understand what steps are involved in the post-enrollment.
Okay. Well, again, I'll just reiterate the step 1 is obtaining proof of the enrollment or denial. And this can also be obtaining proof that a change might have been made. You might be submitting a change of information for a provider on an existing enrollment. And sometimes you might need proof that that change has been processed. So there may be some step there where you might have to call the provider or follow up and obtain your proof of the change. And then step 2 would be implementing with a billing department. Now this is just totally dependent on your organization. This could mean communicating with your billing department, communicating with your supervisor, which would then go to the billing department. It just really depends on your organization, but that's usually the next step, is saying, hey, I've got this provider enrolled, or their changes processed. So there's usually some type of communication that needs to be made between your credentialing or your enrollment department and the billing department. And then also that can also include recording or loading any new contracts or documents into your database. So there may be a repository that your organization has that requires an electronic copy of proof of their enrollment or their contract or something, any type of documents. That would be your next step, is making sure that they're recorded in, if you're recording a note in your credentialing system as far as, yes, we received it, you know, whatever step you're in your process, that would be your next step. And then the last step is just maintenance. And so that's just for continued enrollment. That might be down the road, the provider or the payer asks for an updated insurance certificate, an updated license, a revalidation, or a recredentialing. So this just goes into a little bit further of those steps. So we've already spoken about step 1. Step 2, assisting with any applicable. This is where you would help the provider with any electronic funds transfer paperwork. And again, this is totally dependent on your organization. In my previous experience, I would help implement the provider's contract or their enrollment and help facilitate the electronic funds agreement, and making sure I would work with the billing department and the accounting department, the revenue department. I've worked with our tech, in my previous employment, I would work with the IT department and help the process along with the provider's electronic data interchange or remittance advice paperwork, anything that would need to be submitted to the payer in regard to that respect. So again, this just depends on your organization, but that would be inclusive of that step. And then again, I have a little step 2. We have 2 step 2s. Recording or loading the contract in the database. We spoke of that. Anything that supports that payer would go into your database. And the last step would be just maintenance, sending any changes or updates, new licenses, reattestations. Sometimes payers require that type of thing.
All right. So you walked us through the pre-enrollment and post-enrollment. Now I would like to share with the group my experience of success points, but really, Dina, if you and I could do a point-on-point, so I'd like to introduce the thought, and if you can reinforce it perhaps with an experience or just a reinforcement of another perspective, okay?
Absolutely.
So our first success points, truly beginning the enrollment process immediately after you collect the information as opposed to waiting until you have every piece of information. Pros and cons of doing that. What would be the negative if you wait?
Well, obviously, yeah, the negative if you wait is just longer delay for the provider. So if I already know which plans my organization typically enrolls their providers in, then I would make sure that I have everything that I need queued up ahead of time, so that when as I am collecting the provider's information, I would start organizing the information in the way that I need it in order to submit that application in a timely manner.
Okay. Next point, automating the enrollment process in enrollment software or credentialing software. And of course, logic tells you the more you can automate something, the greater the chance to eliminate errors. So I guess from that perspective, it's kind of a slam dunk. But do you have any stories that you can share on maybe when you're not utilizing a software and you're having to do this manually, an error that you or a colleague had discovered?
Okay. Well, just like you said, as far as a slam dunk, credentialing software takes more time up front to data enter the provider's information, and it is time consuming. It's very tedious. You're making sure you're cross-checking information to make sure that that it's accurate and in comparison to what's in front of you. So in that sense, once it's QA'd, it can lessen errors. But on the flip side, if you've got something in your credentialing software, a component or a piece of information or an element that is incorrect, and not caught, that can come out on the opposite end in your applications repeatedly. So there's pros and cons with each, but in the long run, QAing any information that is data entered into your software, obviously it's definitely the best way to go, because then your applications come out, anything that's submitted via paper, come out accurate.
Mm-hmm.
So,
and that makes sense, again, for those of us who are in the credentialing world. That really makes sense because, garbage in, garbage out. If you don't put the information in the program properly, you're not going to have a product of quality that's coming out. But we all know, too, that by utilizing that software, it really does improve the efficiencies and the continuity of the product, the way the product looks, and how we automatically know this from screen to screen as you're working in the software. It just makes the process for the user, from the user perspective, that much easier. So I was trying to create that crosswalk for many of us who are primarily in the credentialing world. How about the next one then, minimizing the use of paper forms? As we've just addressed, it's so important to try to automate the enrollment process as much as possible because it will eliminate delays in having errored information or incomplete information. Any perspective that you can offer in that regard?
Absolutely. For organizations that are not able to use a software or an online tool, and if you don't have this already, it sounds like a no-brainer, but Adobe Acrobat Pro could be a useful tool as well. And then speaking of, to a smaller organization that might not have the capability for a software product, but even just something as simple as, for if you have to use a paper application, definitely try to use something like Adobe Acrobat Pro and don't handwrite, because that can expedite your process as well. Because if the payer has to come back and double check something or clarify something on an application that maybe they can't read, then that can slow down the process as well.
Okay, and that kind of goes along with this next element. Respond to the payer requests as soon as possible.
Right, that's a very important point, because you would be surprised at how quickly emails and faxes can get lost in your inbox. So, or even letters. Payer requests for additional information can come in a variety of different ways. They can phone call, they can email you, they can send you a fax, and it's real easy for those with everybody juggling as many different things that we have to during our day. It's very easy to get sidetracked or to forget to respond. So always putting the payer requests in the forefront, right in front of you, and responding to them as soon as possible will help expedite the process.
And again, a most important element in any of our practices is to be able to manage expectations, communicate proactively with the providers, letting them know what you need, if there are delays, if there is missing information. So communicate, right, Dina?
Absolutely, that's very important as well. That way, providers don't have to come back and ask you what the status is. It's always good to be proactive and to let them know ahead of time if there are any roadblocks or any speed bumps that you've encountered. It just keeps everybody happy. And that also goes with communicating with your supervisor as well, if there's any type of bump along the way.
All right. Well, again, packaging is so important. So we address the pre and the post-enrollment process, and I want to close the primary content of this webinar really with the same affirmation that we ended in last session, because it's truly about resources, knowing where to go when you're needing help. And that's what this webinar is really about. We don't have to work in a vacuum. There are resources out there, and we can, rather than being stuck in wondering how this works, what this is all about, we have to be able to ask the questions and find out from others what works for them, so it's minimizes any challenges that you might be considering by way of your career or your internal practices that you're following right now. So I'm going to ask Amy to kind of take it here for just a pause moment.
Thanks so much, Donna. We're going to pause briefly for a commercial break to talk about symplr as it relates to this topic. symplr, formerly known as MedKinetics, has a provider credentialing solution that's perfect for the person in your organization who wants to DIY or do it yourself the enrollment process. Our provider credentialing solution has dynamic payer enrollment forms, enrollment status tracking logs, and enrollment reports. If this sounds like something that would benefit your facility, please contact us. We're at sales@symplr.com. That's sales@symplr.com. And now we're going to move along to the Q&A portion of our program. We have just a few minutes and we have lots of great questions. I want to remind everybody that you can still ask questions in the chat box, and if we aren't able to get to your question today, the speakers and the symplr staff will get to view those and we'll be able to follow up with you afterwards. So getting started with our first question from Christopher M. He asks, I'm helping 2 physicians with their private practice with the enrollment of the various payers, or with the various payers. I'd like to get access to the AIS directory or find out what payers are in my state, etc. Can that be shared with us?
Absolutely. Let's see. I have my directory right here. I should have just written it. I'm pretty sure it's AIS.com, but it's Atlanta. It's the Atlantic Health Information. Atlantic Information Service directory.
And should they just Google that, or is that the
Yes.
web address?
Their website is www.aishealth.com.
Fantastic, thank you. Moving on to the next question, we have a question from Michael S. Have you heard or encountered a situation where an enrollment application has been submitted for internal medicine, then upgraded to a specialty after the provider has finished the fellowship? For example, beginning the process prior to the end of the fellowship.
I have not.
Nor have I.
No.
That's an interesting question, though.
Maybe we can pull that of our audience.
Yeah.
For maybe a future response, or maybe in our next session. That would be a good question.
Great. So Michael, you'll get your answer soon offline. Awesome. Moving along, Edna P has a question, and she's asking that you define the third-party administrator.
Oh, okay. That could be any type of administrator, like a third-party billing service. It could be someone who's taking care of your financial billing, that type of aspect of your organization or for the provider. So it's someone who's doing the work on behalf of your provider. Could be a third-party administrator.
Fantastic. I believe we have time for one more question online, and that comes from Karen K. She asks, who typically pays the enrollment fee, the hospital or the practitioner? And does that depend on if the practitioner is employed by the hospital?
Okay, well now this might be good just based on experience from others. In my experience, my providers have paid the enrollment fee, but I can imagine that the hospital or the group would pay the enrollment fee. And if that's any different, we can get comments or poll the audience and have for maybe address it in our next session.
Yeah, and Dina, this is Donna. Yes, that's my experience as well. If it's a contracted service, if it's an employed physician, yes, that organization is the one that pays for that enrollment.
Fantastic. So that concludes our Q&A portion. I'm going to hand it back over to you ladies with just a brief message to the audience saying thank you so much for joining us today.
You bet. Thank you so much for joining us. And before you disconnect, please note the date of Session 3, Running a Successful Payer Enrollment Operation. It's set for Wednesday, March 11th, again noon to 1 o'clock Central Time. Thank you so much for participating. We look forward to Session 3. And Dina, any closing words?
Not other than just saying thank you for everybody for attending, and we hope to see you at our next session.
Okay, perfect.